Do you know the signs of low testosterone? It's more common than you think and can impact your life in significant ways. Testosterone, the primary male hormone, plays a crucial role in our bodies. It's responsible for maintaining muscle mass, fostering a healthy libido, and contributing to our overall sense of well-being. But what happens when these levels drop? The effects can be more far-reaching than you might imagine, affecting everything from your mood to your physical health. In this video, we'll walk you through the top 10 signs of low testosterone. Each of these signs could be a clue that your body isn't producing enough of this vital hormone, potentially impacting your health in unexpected ways. The more you understand about your body, the better equipped you'll be to take steps towards maintaining optimal health. So how can you tell if you're dealing with low testosterone? Let's dive into the signs. The first sign of low testosterone is constant fatigue. Now, we're not talking about the kind of tiredness that comes from a long day at work or a tough workout. No, this fatigue is the type that seems to persist, no matter how much sleep you get. Imagine waking up after a full 8 hours of sleep, only to feel as though you've barely rested. That's the fatigue associated with low testosterone. It's like a shadow that follows you throughout your day, making everything seem a bit harder, a bit more tiring. It's important to remember that testosterone plays a vital role in energy production, so when levels are low, energy can also take a hit. This constant feeling of tiredness can affect your work, your relationships, and your overall quality of life. So, if you find yourself constantly fighting off the urge to sleep, it might be more than just a lack of sleep. It could be a sign of low testosterone. Sign number 2 is difficulty in building muscle. Testosterone is a key player in the muscle building process. It acts as a sort of commander that tells your body to build more muscle fibers, leading to muscle growth and increased strength. Now imagine if this commander wasn't as active or present as it should be. The message for muscle growth wouldn't be as strong, and as a result, you may find it harder to build muscle, regardless of how much you work out or how much protein you consume. This is what happens when testosterone levels are low. Your body's ability to create new muscle fibers diminishes. You might notice that despite your best efforts, your muscles don't seem to be growing, or they're growing at a much slower pace than expected. And this isn't just about aesthetics or strength. Having good muscle mass is essential for overall health and well-being too. So, if you're struggling to build muscle, low testosterone could be the culprit. The third sign is a decrease in sex drive. Testosterone is a hormone that plays a significant role in stimulating sexual desire and arousal, commonly referred to as libido. When testosterone levels drop, it's not unusual for interest in sex to wane. You might find yourself less interested in sexual activity than you used to be. Perhaps you're finding it harder to become aroused, or maybe sex just doesn't seem as satisfying as it once did. If this sounds familiar, it could be an indication that your testosterone levels are on the lower side. It's important to note, though, that multiple factors can contribute to a decrease in libido, including stress, anxiety, and other health conditions. So while a drop in sex drive can often be a sign of low testosterone levels, it's not a definitive diagnosis on its own. Remember, a decrease in libido is a common sign, but it's not the only one. Sign number 4 is mood changes. Testosterone, beyond its physical roles, plays a crucial part in our emotional well-being. When testosterone levels run low, the equilibrium of our mood can take a hit. You might find yourself caught in a whirlwind of mood swings, swinging from feeling fine one moment to feeling unusually irritable the next. This emotional roller coaster ride isn't just difficult for you, but also for those around you. Depression too can creep in, casting a shadow over your usual sunny disposition. It's not just the blues or a bad day, it's a persistent feeling of sadness and loss of interest that doesn't let up. Irritability can also take center stage. Little things that usually wouldn't bother you might start to feel like major annoyances. These mood changes might seem unrelated to low testosterone, but they're often a surprising symptom of this condition. If you're experiencing unexplained mood changes, it might be time to check your testosterone levels. The fifth sign is increased body fat. Indeed, one of the most visible signs of low testosterone can be a rise in body fat, particularly around the waist area. You see, testosterone plays a critical role in regulating fat distribution in our bodies. When levels of this hormone drop, the balance goes off kilter, leading to an accumulation of fat. But here's the kicker. This isn't just about gaining a few extra pounds. It's about where those pounds are showing up. Low testosterone often prompts fat to gather around the midsection, a place it might not have settled before. This can be puzzling, especially if you maintain a healthy diet and engage in regular exercise. What's more, it's not just about aesthetics. Carrying excess weight, particularly around the waist, can increase the risk of other health complications like cardiovascular disease. So, if you're gaining weight despite a healthy lifestyle, low testosterone could be the reason. Sign number 6 is decreased bone mass. Testosterone plays a significant role in our bodies, and one of its jobs is to help strengthen bones. It aids in bone production by increasing bone density, which in turn contributes to stronger, healthier bones. Now, if there's a drop in testosterone levels, this process can be affected. The result? A decrease in bone mass. But what does that mean exactly? Well, think of it as the skeleton becoming more fragile. The bones become thinner and more prone to fractures, and that's something no one wants. This decrease in bone mass can be subtle, often going unnoticed until a sudden fracture occurs. And here's the thing, this isn't just about aging. Yes, bone mass naturally decreases as we get older, but when it's coupled with low testosterone levels, the process can accelerate, leading to conditions like osteoporosis. So, if you're experiencing unexplained bone loss, it's worth checking your testosterone levels. The 7th sign is hair loss. Now, this might be a bit surprising for some, but testosterone plays a key role in hair production. It's not just about muscles and mood swings, folks. When testosterone levels dip, it can lead to hair loss on both the body and face. This is because hair follicles rely on this hormone to grow strong and healthy hair. When there's a shortage, hair growth can slow or even stop altogether. It's important to note, however, that hair loss can also be caused by many other factors, including age, genetics, and stress. So, while it's a potential sign of low testosterone, it's not a definitive one. So, if you've noticed a significant change in your hair growth, it's worth discussing with a healthcare professional. Hair loss can be a distressing sign of low testosterone, but remember, it's just one piece of the puzzle. Sign number 8 is difficulty in concentration. Testosterone is not just a hormone that affects physical attributes or libido. It also plays a significant role in mental capacity. When testosterone levels are low, it can result in cognitive challenges, impairing your ability to focus and remember things. This might manifest as struggling to keep track of tasks at work, forgetting important dates, or even having trouble following conversations. There's a scientific reason behind this. Testosterone aids in the production of neurotransmitters that encourage tissue growth in the brain. When these levels dip, it impacts the efficiency of these neurotransmitters, thus affecting our ability to concentrate and our memory function. It's important to note that these symptoms can also be associated with other conditions or lifestyle factors, like stress or lack of sleep. But if you're noticing a persistent difficulty in concentration coupled with some of the other signs we've discussed, it could be an indication of low testosterone. If you're finding it hard to concentrate or remember things, it could be due to low testosterone. The 9th sign is hot flashes. Now that's a phrase you might not expect to hear in a discussion about men's health. But hot flashes aren't just for women going through menopause. Men with low testosterone can also experience them. Hot flashes are sudden feelings of heat, often accompanied by a flushed face and sweating. They usually last between 2 and 30 minutes and can be mild or severe. This unexpected warmth can be unsettling, especially when there's no apparent reason for it. But if you're a man experiencing hot flashes, there could be a reason. Low testosterone. Testosterone plays a vital role in regulating the body's temperature. When levels drop, the body's thermostat can go haywire, resulting in hot flashes. While less common in men than in women, hot flashes in men are not to be dismissed lightly. They can disrupt sleep, cause discomfort, and be a clear sign that something is off. Experiencing hot flashes, it's not just a female issue, it can be a sign of low testosterone in men too. The 10th sign is difficulty in achieving an erection. This isn't a topic many feel comfortable discussing, but it's important to acknowledge that it can be a significant sign of low testosterone. Testosterone plays a vital role in the sexual health of men. It stimulates the production of nitric oxide, a molecule that helps with the relaxation and opening of blood vessels necessary for an erection. When testosterone levels are low, the production of nitric oxide can be insufficient, leading to difficulties in achieving an erection. It's not just about sexual performance, it's about overall health and well-being. An inability to achieve an erection can sometimes be the body's way of signaling that something isn't right. Remember, it's always a good idea to consult with a healthcare professional if you're experiencing this or any other signs of low testosterone. They can provide guidance and possible treatment options. Remember, difficulty in achieving an erection can be a significant sign of low testosterone. So there you have it, the top 10 signs of low testosterone. We've navigated through a variety of symptoms, from fatigue and difficulty in building muscle, to changes in mood and libido. We've also explored the physiological signs, such as increased body fat, decreased bone mass, and hair loss, not to forget the cognitive challenges like difficulty in concentration, hot flashes, and issues with achieving an erection. Each of these signs is a potential indicator of low testosterone levels. However, it's important to remember that experiencing one or more of these symptoms doesn't automatically mean you have low testosterone. It's crucial to seek professional medical advice to accurately diagnose and address the situation. Knowledge is power, and understanding these signs can help you make informed decisions about your health. Remember, low testosterone is more common than you think, and recognizing the signs is the first step to getting the help you need.